Health Nuts, episode 35.
The problem is that people are lost in medicine. They're relying on what the doctor's telling them, but they don't understand. And so education for us gives that person hope, because now they know what that value means and what it means to be at the bottom of the range or the top of the range, and whether that's normal or not, because usually it's not. You can be in range and it's not normal for you.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr. Today I have on a great guest for you, and that is Dr. Loya. She is originally from Greensburg, Pennsylvania, and she is a graduate from the University of Notre Dame and Northwestern University Medical School. She completed her family medicine residency program training at the University of Illinois at Chicago. She spent 10 years practicing family medicine and also worked at UPMC Shadyside, where she helped run the family medicine residency program. She left UPMC in 2008. She went to start her own practice called the Hormone Center, and this is an integrative and holistic medical practice. The mission of this practice is quite simple. It's to combine traditional medicine with a more holistic method of treatment that strives to uncover the root cause of illness rather than just managing symptoms. She's board certified as a family physician, and she's also certified through the American Board of Integrative and Holistic Medicine. So that was a formal intro of you, Doc. Tell us a little bit more about yourself.
Well, I'll start with saying, as you can see from the intro, my background is in very traditional Western medicine here in the United States. And a lot of my patients and other people I meet wonder, how did you get from there to where we are now as far as the type of healthcare we provide? And it kind of happened this way. I was teaching family practice residents at UPMC Shadyside. So I was training people who had already finished medical school to become family doctors. And over time, in addition to seeing my own patients, I realized I was teaching people this very traditional medical model that I started to feel was outdated. And I thought it was outdated because we were dealing with the majority of problems people came with being chronic illnesses, and we were still addressing those in the age of when penicillin was discovered. So that is how our Western medicine system developed as it is. We have a disease like pneumonia or sinusitis or a urinary tract infection. You treat it with an antibiotic and it's better and resolved. And that model worked well for acute issues like infections, like trauma, injuries, and in some cases even surgeries. But over time, as we eliminated those causes of illness and death, now more people are developing chronic illnesses. And that diagnosis, disease, drug model doesn't work so well, and it really band-aids the situation. So I got really frustrated with seeing people in their 60s come in on 13 different drugs, and oftentimes 4 of those drugs might be used to treat side effects from the first 4 drugs that they were on. And most strikingly, nobody felt good. People lacked energy, they were tired, they were depressed, they were achy and in pain. And I didn't have the tools to help them. And I didn't have the time to help them. And I got frustrated and I almost left medicine altogether. I was going to go open a bookstore. And that was in 2007, before all the ebooks, and it would have been a really bad idea.
I can only imagine the frustration after going through all those years of school to want to then hang it all up.
Right. And so I sat down and I thought to myself, what is there another way to approach this? Is there a way that I can use the diagnostic skills, the training, the knowledge that I have to approach patients in a different way? And at that time, that was back in 2007, 2008, there were starting to be more information on the internet and conferences on integrative medicine and hormone balance. And I thought to myself, if I can address problems in this more holistic way, often before they become full-blown diagnoses or full-blown symptoms, if we could recognize that chronic disease is really just a symptom of major imbalances in the body, could we prevent, could we reverse and kind of take people backwards in time and really get healing versus, hey, let's just give you this drug to treat a symptom.
Yes, it's obviously that's the model, the Western medicine model. So for you to be able to do almost a 180 from that, it's a complete change, and a lot of folks don't go down that route. One of the things I want to get into with you, because I'm really interested to hear your message on this, is hormone balance. Maybe if a patient's suffering with a hormone balance, or how would they even know to get their hormones checked? So I guess from the basics, for a layperson, what are the hormones?
Right. So, we have hundreds of hormones in our body, and a lot of them we're not even really sure how to measure or how to look at them. But in focusing on what a hormone is, first of all, a hormone is just a chemical messenger in the body. It takes information from a gland or the brain to another cell in the body in order to turn on or off various functions in all the cells of the body. So all of our cells have receptors for all of the hormones. So, as examples, some of the hormones that we deal with include thyroid, estrogen, progesterone, testosterone. Well, estrogen, progesterone, testosterone, those sex hormones, we think of in terms of, menstrual cycles and fertility and sexual function. But really, all of those hormones, in addition to the others, have functions in every cell of the body. So, and more importantly, they are all integrated. So levels of one can affect levels of the other, and abnormalities in one can affect the other. So when we look at hormone balance in our patients, our most common patients are women around menopause or at menopause, because that's a very distinct time in life where there's a major change in the hormones in a relatively short period of time. And so a lot of the symptoms that we see around that time are, mood swings and irritability, anxiety, hot flashes, night sweats. And so many of these women, again, in that traditional medical model, go to their primary care doctor or their gynecologist, and they get put on antidepressants and sleeping pills to address these symptoms that are happening because of the changes in hormones. At the same time that that's happening, those levels can affect thyroid gland function. And thyroid in all patients is responsible for our baseline energy, metabolism, detoxification systems in the body. And what we've noticed is that fatigue is a nearly universal symptom. I hardly have a patient who comes to us who isn't tired. It's such a common thing out there in the world. You'll hear people say, "Oh, how are you today?" "Oh, I'm tired." It's become so normal that some people don't even realize that they're fatigued. And many have had their thyroid checked. And in medicine, it's done in a very cursory fashion, only checking the TSH, which is the signal from the brain to from the pituitary gland to the thyroid to make thyroid hormone. And really, when we look at that, we want to know, okay, well, how is that signaling happen? What's the T4 level? How much hormone is the gland making? How is it being converted into its active form T3 or reverse T3 that blocks it? Are there immune issues with the thyroid? Are there nutrient deficiencies that could be affecting thyroid function? So, thyroid and those menopausal symptoms are probably two of the biggest hormonal imbalances that we end up dealing with.
Now you have these patients. Now they're symptomatic. So they're coming to whomever doc that they end up with, and maybe they're having the mood issues, the irritability issues, and typically they're put on one of those medications. Now, for you, what type of testing would you possibly run, or what other things would you look for to make sure they need to be going a different direction?
Well, a couple of the things we do, like I said, we check thyroid pretty thoroughly in all those ways we discussed. We like to do saliva testing, which many people have never heard of,
Right.
But it involves collecting saliva and sending it off in the mail to see what's the balance between their estrogen and progesterone levels, either at a certain point in their cycle, if they're still having periods, or if if they haven't had periods, it could be any time, but we're looking for that balance. And also in men, as their testosterone levels drop as they age, they can also experience similar symptoms, but it tends to be over a more gradual period of time and as a less recognizable, group of years. But that saliva test really gives us a better idea of how much of those hormones are getting out of the bloodstream and into the cells where they actually have their effect. And we can sometimes see a difference where, the levels in the blood are decent, but for some reason, those hormones aren't getting into the cells. And one of the common reasons that we see for that, and the other major hormone system that I failed to mention, is the adrenal glands. So when our bodies are under stress, and that stress can be physical stressors, emotional stressors, work, it could even be good stressors like, travel or building a new house or, things that people really look forward to. But when under stress and the body's making a lot of cortisol, that can block a lot of the other hormone entry into cells and make even those good blood levels not get through to the saliva. So we also look at cortisol levels in the saliva, and preferably 4 times throughout the day, so that we can see what's the pattern of stress hormone release and where those abnormalities might be.
And these testing, so the testing, we get the saliva testing done, we know that's off. Maybe we check the adrenal glands, we see that they're misfiring. And now treatment protocols, I know they vary from patient to patient, but it as a baseline or as a foundation, what are some things you would address with the patient to work on getting their levels back to normal?
Yeah, so this is an area that's evolved for me and for our practice over time. There was a time where we just replaced all the hormones that were deficient. So if thyroid looked like it was low, we would give thyroid hormone. If the adrenals were low or high, if they're very low, often we would give hydrocortisone, which is our body's natural form of cortisol. If estrogen and progesterone are missing, we can give those back. And a lot of times, in fact, the majority of the time, we use compounded medications so that I can get an exact dose that I want for this patient based on their labs and their symptoms and where they're going to feel the best. And when we use our estrogen, progesterone, testosterone, we use what are called bioidentical hormones. Meaning that they match exactly the hormone molecule that the body would have made. So it's, although they're prescription, they're substances that the body doesn't recognize as having come from outside itself. And so therefore, the possibility of having major adverse effects from it are less likely, and you're more likely to get effects of either too much hormone or too little hormone, but all in that expected realm of what the hormone does. Now, the key to this, though, is that it is so individualized. There's no, 2 patients that are necessarily on the same regimen. And again, this is another departure from that I had to kind of get over and move past from regular medicine or traditional medicine, because it's now so based on algorithms and protocols, and you give this X for Y and Y for Z, and you follow this pathway. This is what we're trying to do, is personalized and individualized medicine that takes all of those factors into account. And the other point I want to make is, yes, it's important to replace all those hormones so that the messages in the body start to get sent in a better fashion. But what the other thing we've learned over the 10 years that we've been doing this is that you could take 2 patients with similar symptoms and similar lab results, give one patient a little bit of thyroid hormone and some progesterone, and they say, thank you, I have my life back, I'm back to normal. And then you give another patient that very same treatment, and it doesn't seem to be working. They still feel fatigued, they're still having symptoms. And that's where we started to look deeper and now start to incorporate, well, are there nutritional deficiencies? Are you having issues with your gut health where you can't absorb some of the things that we're giving you, whether it's vitamin D or iodine or iron or zinc? Is that all getting in properly? What is stress like in your life? Is it so overwhelming that no matter how much stuff we pump into your body, it's not going to have any effect because those adrenals are so in fight or flight mode constantly? Looking at sleep patterns, looking at fitness and movement. I think we've now departed to kind of now, oh yeah, those hormones, it's better than the Band-Aid and better than the symptom, but what can we do deeper than that to affect true healing?
Yeah, I know a couple of docs that have gone down this path with it, and one of it is with these bioidentical hormones, but I know there's some other recommendations that they'll go with it as well, which you were kind of leaning towards. Outside of, with the stress being the major issue, if they don't identify the stressor and they continue to have the exact same stress, then the symptoms typically don't end up going away because the root of the problem has never been really addressed. What else would you tell a patient who's, maybe they've gone down to bioidentical hormones, but they need to make some nutritional, other lifestyle changes? Where would you have them start?
Yeah. So what I tell patients is, me recommending certain supplements and hormones, that's the easy part. They can put capsules in their mouth all day. They can, put on their hormone creams, but the more difficult part are these life changes. And, I'll tell you personally, my life change struggle has been sugar. And it's been that way since I've been a teenager. And, we look at all of this. It's very overwhelming, all the nutrition advice out there. Should I be paleo? Should I eat a ketogenic diet? Should I be vegan? Should I be vegetarian? Should I eat a plant-based diet? What do you eat? It gets so confusing. And in reality, it's so simple. And I have people start with that. I have them start with, address the sugar issue in your life, because and I'm sure you know this, but we eat 140 pounds of sugar a year on average per American. And so, you put that on stressed adrenals, and I think it just compounds. So we start to focus a lot on that. And, there are people who should be gluten-free and dairy-free but again, that can be so overwhelming. So we try to meet the patient where they are and help them make one change at a time with their nutrition. We help them try to identify those stressors. And we're not psychologists or counselors or social workers. And we know people have to live in the world. People can't ditch their families and their jobs and go live on a desert island and have no stress. But, trying to give them little things that they can do to help work on that. So those are some of the things that we do.
If they're trying to reduce sugar, because it's in everything almost, and it's with the U.S. being one of the sickest industrialized countries, if not the sickest, and one of the reasons because of what's in our nutrition. When people think of sugar, they might just think of the sugar that they're putting in their coffee. What are some other places that they need to look at for hidden sugar?
So any processed food, so any food with a label likely has some sugar in it. And I'm sure you've heard, and I don't know if the general population knows yet, but there are new guidelines coming out from the FDA for labeling things that will actually separate out total sugars and added sugars. It's not strict enough for me yet, but at least it's a start for people being able to see that. But for example, even in eating plain yogurt, that dairy might have sugar in it. Fruit is a source of sugar. And I'll give you a quick story about that. I have a lot of patients who are pre-diabetic who want to, prevent the progression to diabetes. And, we tell them to eat more fresh vegetables and fruits and cut down on processed foods. And this one patient came to me and he was so proud because he had cut out all cookies, candies, even white flour, and he was doing great. But his sugar numbers were still high and his triglycerides were still high. And we were trying to figure out why could this be, because he hadn't had any of that. He was eating all whole foods. Well, I found out he was having 9 servings of fruit a day, right? And fruit, you think, wow, that's really healthy. And I'm having this apple or this orange instead of a cookie. But at 9 servings a day, that's still an awful lot of sugar.
Yeah, you're going to be well over at 90, close to just 100 grams in fructose a day.
Correct.
And we know, and with the FDA, and what they're recommending is less than 40 grams, and I'm way below that as well as what we'll put our patients on that are trying to make changes, just because the issue with sugar is the inflammatory processes that it presents.
Right, and we actually go we tell people to try to stay under 20 grams a day.
Yeah, that's great. And it's a huge challenge. It's a wake-up call for most to try to get down to that level.
It is. But, there's hope in that too, because, sugar is an addiction, right? So it goes to the brain and releases dopamine. And so people will then seek out more sugar to feel better temporarily. And it's a vicious cycle. However, the good thing is for the majority of patients, if they can cut it out and cut it down to 20 grams a day, those cravings mostly go away.
Right.
And
yeah. If you can kick that habit, so many other things will fall into place,
right.
especially hormonally.
Right.
One of the other things you were touching on, which I wanted to go back to, was movement and the type of movements that take place. What are your recommendations for movement? What would you, if somebody's just maybe the couch potato, what would you have them do?
Yeah. So this is again, a difficult area, because I think, people read things on the internet and they get this idea that they have to be perfect about it. You've got to exercise 1 hour a day, 5 days a week. And, it becomes so overwhelming. But most people, if you break it down into times in their day that they can work this in, they can find time. So for example, if they have a desk job and they're sitting, even just setting an alarm on their phone or their watch to every hour, get up and move around for 5 minutes, walk down the hall to the cooler, go take a bathroom break, do something to get up and move. These days they make these standing desks where you can get up and down and get into different positions. What I've done personally is I've put some breaks in between my patients through the day, so that in between patients, I might take 5 minutes and do 10 push-ups, or, stretch a bit, or I keep some weights in my office. It doesn't have to be an hour of continuous exercise a day. And so, we focus on what's that little thing that you can commit to kind of move this forward. And once people start doing that, they're more likely to get more consistent with movement.
With stress being such an issue, a lot of folks think they need to be, they hear movement like, I need to go join the gym. I need to exercise for an hour to an hour and a half. So if I'm hearing you correctly, we can get it done in a lot shorter time.
You can, and you can do that half hour or an hour. If you have an 8-hour day and you take, 7 5-minute breaks, you've done 35 minutes. Now, for cardio and for building endurance and things like that, you have to do some more sustained activity. But, I think one of the things that's most overlooked in fitness is actually, building muscle and weight training, because that's what really temporarily increases the body's metabolism and helps to, burn some calories and promote strength. So.
And the longer you exercise, we know that the stress it can put on your body, it can actually go counterproductive. It can produce more stress on your kidneys and various aspects of your body. Outside of strength training, so the cardio, is there a certain type of cardio you would recommend to someone, just as long as it's running or jogging or elliptical? Does any form count?
Any form counts, with the exception, again, remember, I have a lot of postmenopausal women and perimenopausal women in my practice. And for them, I do encourage those types of cardio where they're actually bearing weight. So, less so with like swimming and biking, although that's fine. That's not going to help build bone strength as much as walking or running or, stair stepping or even elliptical. But I think one of the keys to this, again, is you don't have to go out and run an hour. You can do interval training where you do 20 minutes of, a slow jog and then sprint for 30 seconds, slow jog, sprint for 30 seconds. And that actually is going to build your endurance, your strength, your stamina, and have better effects on sugar and insulin metabolism than running, at a moderate pace for 40 minutes.
Love it. For someone who's not symptomatic, let's say, you have the 40 to 50-year-old male or female, they're not producing any symptoms. They're not having the mood or the irritability issues, but maybe they have a family history with, diabetes, mellitus, or they have the high blood pressure, or they just got the other chronic health problems that run in their family. Do you recommend them get tested as well? Or are you just saying wait till you become symptomatic?
Absolutely not. In fact, most of us have issues that need to be addressed and can feel better and do better with all of those aspects of health in our lives. And I want to mention, you mentioned that family history. One of the things that, again, I've learned is a lot of patients come in and they say, I have this family history. Everyone in my family gets diabetes. I'm going to get diabetes. Or
Right.
everyone gets high blood pressure or heart disease. All the men die of heart attacks at 42. That's what I'm destined for. And again, there's a message of hope here, because there's a new field of medicine that goes beyond genetics called epigenetics. And within that is that message that we actually have power over the expression of our genes. And that, to me, is one of the most hopeful things I've seen in medicine in a long time. Because what that means is, just because every man in your family died at 42, you actually don't have to. And it gives us control. And with that control comes responsibility to start to make these changes. And it's not magic. I mean, the things that affect the genes are, what you put in your mouth. Are you eating whole foods and avoiding sugar and avoiding processed foods? Are you doing that? Are you moving? Are you sleeping? Are you getting a good 7 to 8 hours of sleep a night? Are you reducing stressors and managing the stressors that you do have? And then, the first place you're going to see that off, even maybe before the symptoms develop, is going to be in hormone balance. So checking those hormones can give a clue to how well you're doing with all of those items that I consider the pillars of health.
One of the things we'll discuss with our patients is a lot of these conditions we've been talking about, that they're lifestyle related. And, if you can lifestyle your way into it, we always say you can lifestyle your way out of it as well.
Right.
Before we move on, I did want to go over one other case with you. And maybe now you've seen this patient, which I know you've seen in your practice, and they say, hey, you know what, doc? I've been diagnosed. I've tried X, Y, and Z. Nothing's worked. I'm frustrated. I don't know which way to turn. I don't know who to believe anymore. For somebody who's sick and tired of being sick and tired and they're just frustrated to no end, what do you tell that patient?
Well, that's the most of the people who come to us. So it's not a rare patient who
Commonality.
Right. In fact, we have a couple different questionnaires that we give people depending on what they're coming for. But one of that questionnaires has a question on there: how many doctors have you seen for this before you got here? And often it's 7, 8, 9. And so I think what we tell them first is we do some pretty extensive testing. Quest Labs knows me, and the phlebotomist will say, oh, it's one of their patients from the hormone center, because they get, 12 to 14 tubes of blood done, because we're not just doing a cursory look where let's look at your liver and kidneys. I mean, we're going down into nutrients and immune system issues. We're looking for inflammation. So I think in that, and then on top of that, doing the saliva test to look at the adrenals, and it's a very comprehensive view. But the key to it is that it's not just about that testing. It's about, can you take the patient's symptoms? Because again, with symptoms, those patients are going to tell us 90% of the time what's going on. If we just sit and listen to them, you could figure it out. And the labs help us support and guide that treatment. So to know that, someone's going to spend an hour with them and sit down and decide what the testing is based on their symptoms, and then, come back and go through those tests line by line and explain what they mean. I think some of the problem is that people are lost in medicine. They're relying on what the doctor's telling them, but they don't understand. And so education for us gives that person hope, because now they know what that value means and what it means to be at the bottom of the range or the top of the range, and whether that's normal or not, because usually it's not. You can be in range and it's not normal for you. So I think that is how we try to give them hope that yes, this can be different.
That's so true. With the blood work, when it shows up in normal, that just means you don't have a disease yet.
Right.
Yeah, I love that share. Before I let you go, I always like to know if somebody out there, they're trying to, a lot of this has resonated with them, and they're looking for you, or they're looking for somebody like you. How do they go about finding you?
So probably the best place is our website, which is hormonecenter.net. There we have a lot of descriptions of the various conditions that we deal with, the different types of testing that we do, the different providers are in their office. It's a pretty robust site with a lot of information.
And for the audience, if you're looking for other doctors, and if you're a practice member of ours, or if you are not even in the general area, but if you're looking for something outside of the box that you might have found yourself in, this is an answer for a lot of the questions you might be experiencing. And this type of medicine is the up-and-coming medicine. In 10 years, this will be the norm, not so much the outside looking in. So Dr. Loya, I appreciate you coming on so much. It was a privilege having you on and having you share your message.
Yeah, thank you so much. It was an honor to be here with you.
And to the audience, we'll catch you next week. The links to her website will be in the show notes, as well as her general info. So if you have any other questions, feel free to reach out on that, and we'll throw the website email address on there as well. Outside of that, have a blessed week. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.